A controversial warning from President Donald Trump has stirred widespread debate in the medical community. Speaking from the White House, the president, joined by Health and Human Services, HHS, Secretary Robert F. Kennedy Jr., Centers for Medicare and Medicaid Services Administrator Dr. Mehmet Oz, and other officials, suggested that acetaminophen, widely known by its brand name Tylenol, could pose risks during pregnancy. Trump told reporters, "Tylenol is not good. Don't take it." The statement was made as part of a broader announcement in which the administration claimed to have found a link between acetaminophen use during pregnancy and autism in children. Officials also warned about possible liver toxicity and even suggested the drug could prolong viral illnesses in children. The president stood alongside Secretary Kennedy, Dr. Oz, and others, presenting what they described as new concerns about the popular pain reliever. Kennedy elaborated that acetaminophen, a medication long considered safe for pregnant women, might not be as harmless as once believed. He cited suspicions of developmental risks, including autism, when taken during pregnancy. Kennedy argued further, 40 to 60% of mothers who have children with autism believe there is some link to a vaccine. He went on to claim these mothers had been gaslit by the science, despite repeated studies showing no proven connection between vaccines and autism. This line of argument echoed Kennedy's history of promoting theories linking vaccines to autism, a stance that mainstream medical experts have repeatedly debunked. Current medical guidance contradicts the administration's new warning. Acetaminophen remains the most widely recommended and considered the safest pain relief option for pregnant women. The American College of Obstetricians and Gynecologists, ACOG, released a swift response to Trump's remarks. ACOG's chief of clinical practice stated, "There is no clear evidence that proves a direct relationship between the prudent use of acetaminophen during pregnancy and fetal developmental cues. Doctors emphasize that while studies have raised questions, there is no proof of causation. Most analyses suggest at best a weak association that could just as easily be explained by other factors such as fever, infection, or genetics." CNN medical correspondent Meg Terrell explained that the administration may have been referring to a recent meta-analysis of 46 studies. That review did find a statistical association between acetaminophen use in pregnancy and conditions like autism or ADHD. But crucially, the review did not establish causation. Terrell clarified, "There's a potential association, but there is not a direct link or cause." One of the most troubling parts of Trump's comments was his suggestion that Tylenol should only be used for very, very high fevers during pregnancy and otherwise avoided. Medical experts countered strongly. Leaving fevers untreated during pregnancy can endanger both mother and fetus. High fevers are known to cause complications, and acetaminophen is often the only safe way to bring down dangerous temperatures. Terrell stressed that Tylenol remains a really important medication to be able to use to treat fever during pregnancy. She added that the data presented by the administration does not support discouraging its use in such cases. Kennedy attempted to soften the stance by advising that doctors should go with as low a dose as possible, guidance that aligns with standard medical advice for all painkillers during pregnancy. Still, the overarching message from the administration that acetaminophen is broadly unsafe alarmed physicians who fear pregnant women might avoid necessary treatment. The announcement also ventured into familiar territory for Kennedy, vaccines and autism. Kennedy again highlighted claims about vaccine safety, despite decades of research disproving any link. He suggested his agency is investigating multiple areas of concern related to vaccines and said he has directed officials to continue probing possible connections to autism. Additionally, Kennedy raised folinic acid, a dietary supplement, as a potential therapy for reducing autism symptoms. The inclusion of supplements and vaccine references during what was billed as a medication safety briefing suggested to many a broader agenda at play. Trump further inflamed controversy by pointing to groups and countries he claimed showed lower autism rates because they did not use Tylenol. The president asserted there's no autism in the Amish community. He also suggested that Cuba, where he believed acetaminophen was unavailable, had no autism cases. Experts quickly dismissed these claims as unfounded. Studies have shown autism exists in the Amish community, though exact rates are difficult to measure due to cultural and diagnostic differences. Similarly, autism is reported worldwide, including in Cuba. Researchers note that both genetics and environmental factors play roles, making such sweeping claims scientifically inaccurate. The White House briefing was meant to sound alarms over what officials see as overlooked health risks. Instead, it drew immediate pushback from scientists who worry that undermining acetaminophen could lead to more harm than good. Doctors stress that the drug's benefits, particularly in controlling fever during pregnancy, remain vital. Discouraging its use without strong evidence could put both mothers and babies at risk. What many observers found especially troubling was the blending of medication concerns with long-running vaccine autism theories. That move risked muddying the public health message and reigniting discredited debates. The administration said it is investigating further and promised to provide more clarity in coming months. Kennedy had previously pledged that causes of autism would be better understood by September. Still, the immediate impact of the announcement has been confusion and concern. Expecting mothers now face conflicting signals, a president warning them away from Tylenol and the medical establishment urging them not to panic. As Terrell summarised, the science remains clear for now. Acetaminophen is still considered the safest option for fever and pain during pregnancy, and the smallest dose for the shortest period of time is always the advice. The White House's move has opened a new front in the battle over public health messaging. By raising questions about Tylenol and linking them to vaccines, Trump and Kennedy have amplified fears that experts say are not supported by solid evidence. The real risk may not be from acetaminophen itself, but from the confusion created when political leaders override established science with speculative claims. Medical authorities continue to recommend Tylenol for pregnant women when needed, underscoring that untreated fevers carry greater risks than the drug itself. As the debate unfolds, one thing is clear. The conversation around autism vaccines and medications is far from over, and the political spotlight ensures it will remain one of the most charged topics in American public health.